8,000 samples out of these 9 labs, and we have 295 positive cases, and out of which someone will discharge it out because they cured well, and we have now 251 cases, positive cases in hospitals. And we want to implement that rapid test also. Now ICMR permitted rapid test also. Yesterday we got 2000 kits for rapid test. We applied for the kits and we are waiting for that. And yesterday we got these 2000 kits, and we have to try to test rapid test also. But rapid test only is not sufficient, When the positive thing of the rapid test is the result will get at once and within a short time. And also, if a test become positive through the rapid test, the antibody test, we have to confirm it through PCR test also. And the positive thing is that we can get all the positive cases at once, and we can give our attention to that cases. But one thing is that if it is negative, we cannot put them away from our quarantine. We should continue that quarantine. False negative may come, so they should wait the 14 days to fulfill their quarantine period. That is the negative part of the rapid test. If anyone develop that false security feeling after this, we are thoroughly watching that, and we are giving awareness that if the result from rapid test is negative, they cannot full stop or they cannot end their quarantine.